Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India. I would like to welcome you all in my Ayurveda Academy YouTube channel. Today's video is regarding a continuation of Srotas Pariksha in Ayurveda. Srotas concept is very important for Ayurveda, for practicing Ayurvedic medicine, Ayurvedic Siddhanta, Ayurvedic philosophies. So Srotas, they are like the channels. They are innumerable. We cannot count them in our body. But for the practical purposes, Ayurveda has described 13 important Srotasas. They are like Pranavaha Srotas, Annavaha Srotas, Udakvaha Srotas. Pran, Anna, and Udak, like for oxygen, food, and water. And then Sapta Dhatu, 7 tissues, Rasavaha Srotas, Rakta, Mauns, Med, Asthi, Majja, Shukravaha Srotas. And 3 Srotasas are of waste products. Mutra Vaha Srotas, urine, Purisha Vaha Srotas, excretory system, and Sveda Vaha Srotas. So each Srotasas, Ayurveda has described in very Sroto Vimani Adhyaya in Charaka Samhita. But you must understand that for the practical purpose, we have to consider this particular Udak Srotas examination with the threefold system of examination, like Darshana, Sparshana, and Prashna. You must remember these Trividha Pariksha, threefold examination from Ayurvedic style of examination method. Darshana is like inspection with your naked eyes or with some instruments like endoscopies. And then Sparshana includes 3 types in the modern medicine: palpation, percussion, and auscultation. And also then the Prashna Pariksha is like a history taking or interrogation, questioning to the patients. Darshana, Sparshana, Prashna is always done at a physiological level or physiological aspect, and then the pathological aspect. Physiological aspect is a prakruta in Ayurveda, and pathological aspect is vikruta. These srotasas, in the granthas, they have explained the sroto dushti karane, causes why the srotas is disturbed. Then sroto dushti lakshana, what are the symptoms created with the disturbance in the activity in the processing of this particular srotasas. Today we are going to discuss about Udakvaha Srotas. First is Darshana Pariksha, that is physiological aspect. You must test or you must check the physiological normal softness and moisture. How much is the dravata is there? Whether they are looking little bit soft and with some moisture, or they are totally dry. You have to see the lips, you have to see the tongue, you have to see the eyes, and you have to see the skin. So these are the 4 organs where you can understand the water and electrolyte balance in our body. Udakvaha Srotas, I personally believe, is related with the water and electrolyte balance or the homeostasis in our body. Next, Darshana Pariksha, abnormal, pathological aspect. In case of the condition, for example, if the person, if the child, if the patient is suffering from diarrhea, vomiting, dysentery, they can lead to the loss of water, and that is called as the dehydration. This is a problem of Udakvaha Srota. Udaka is a water. Don't forget, Udaka is a water. But I personally feel not only water, water plus electrolyte is together is Udaka in Ayurveda. Okay, so it includes plasma, it includes extracellular fluid, it includes intracellular fluid, everything whichever can come under the liquidity is under the Udakvaha Srotas. So these diseases, they cause the dryness in the body. And so you can see the lips, for example, in the children up to 2 years of age, very small child, if he is suffering from loose motions and the vomiting, gastroenteritis or gastro, then tongue becomes totally dry. Sometimes the child, like this, see what I'm doing, rolling the tongue over the lips. The child is doing and telling you that, see, my body is dehydrated. So this particular symptom, or this particular, it's not a symptom, it's like a observation. You can detect, you can indicate that this particular child is suffering from the dehydration when he is rolling the tongue over the lips, okay, just to moisten that particular lips. Then the skin becomes dry and rough, appearing parched and lacking the luster, and eyes, they can be dull, sunken, and lifeless because of the dehydration. Dehydration can have the various symptoms and effects on the body. It is important to take the medical advice, medical attention, and proper treatment if anybody is suspecting dehydration, grade number 1, grade number 2, grade number 3. Grade number 1, yes, you can treat by the general practice level, but for the gradation 2 and 3, the child, especially or the old people, they must be admitted in the hospital, okay, to get some IV infusions. Then, Darshana Pariksha pathological aspect continued. In children below 1 year of old, dehydration can cause here, depression in the vertex part of the skull. Okay. If there is obstruction in Udakvaha Srotas, which is called as a Srotorodh, Srotosang, then Udaka Dhatu start oozing out from the natural transport system. Okay. Extravasation coming out. And that is called in Ayurveda Udaka Dhatu Vimargagaman. That means is losing, is diverting from the normal track. That is Vimargagamana, diverting from the main tract, diverting from the main road. Okay. In such cases, what is happening? If the plasma is coming out, the water is coming out, then that can cause the edema, swelling. That is observed during the physical examination, or an enlarged and protruded abdomen, like for example, ascites, can be seen as a problem of Udaka Dhatu or Udakvaha Srotas. After Darshana, Sparshana. Examine the natural suppleness and elasticity of the skin. Very easily you can test. Just pinch the skin and lift it up. Here, you can see. Lift it up and drop it. Then that particular wrinkle should vanish if we have the properly hydrated. But if the person, the child or the old people, they had dehydrated, that wrinkle will not vanish. That is a loss of elasticity. You have to check the elasticity for Udak Dhatu, water, electrolyte balance. Check the condition of the veins and blood vessels. Because if there is a too much dehydration, there even for giving the IV, even giving the IV injection, the doctor cannot find the vessels immediately. Okay, that is called as a collapsed blood vessels, because all the liquid part has been drawn out. Assess the speed and strength of the pulse. Pulse examination is very important for Udaka Dhatu Pariksha, Udaka Dhatu Srotas, because if the loss of water is there, then the pulse is always feeble and but tachycardia, very fast, but very feeble. Okay, next. We are talking about Sparshana Pariksha, palpation, percussion, auscultation. In severe dehydration occurs due to the conditions like vomiting, diarrhea, dysentery, atisar, pravahika, chardi, Ayurvedic words. Even the atimutra pravrutti, polyuria, increased urine output, for example, diabetes mellitus, and excessive sweating sometimes, then there will be dryness and suppleness of the skin can be assessed by touching the skin, Then you have to check again by palpation whether the fontanelle, soft spot on the head, is sunken in the child less than 1 year. If the pulse is weak, slow, and sometimes not palpable through the touch, that is feeble pulse. Blood pressure is always like a hypotension. Hypovolemic shock can occur when there is a too much hypotension. If there is edema due to the impaired circulation, Vimargagamana, examine the areas of edema by applying the pressure. If there is edema on the leg, apply the pressure by thumb, okay? Press and observe if the indentation, that pit, feels back quickly, that indicates the pitting edema, that is indicating Vataja Shoth in Ayurveda. Then press and observe if the indentation does not fill back, that indicates non-pitting edema, which is Kaphaja Shoth. So you can clinically immediately distinguish which is a Vataja type of edema, which is a Kaphaja type of the edema. Okay. If in diseases of the abdomen, perform the palpation through the touching the abdominal wall and abdominal skin. Next, check the dullness below the navel or umbilicus and on both sides of the abdomen, indicating fluid accumulation. These are the typical, you can say, the signs, horseshoe shaped dullness. I have the video, I have the separate video on this examination of the liver cirrhotic patients in my mobile app. So you can purchase the program Clinical Examination. Fantastic fantastic. All the types of the clinical examinations, modern, allopathic, Ayurvedic way, we have discussed. We have the PPTs, videos, everything on my mobile app. Okay, so you will get the details over there. Perform the fluid thrill tapping. Fluid thrill, a sensation of fluid movement on palpation, it is called as a fluid thrill, a typical signs of ascites. In Ayurveda, ascites vyadhi disease is called as udar ascites. Perform the shifting dullness by tapping on the abdomen and observing the shifting dullness. All are having videos on Deshpande sir mobile app. Prashna Pariksha, last but not least, interrogation, history taking. How much thirst is experienced by the patient? That depends on the patient's constitution. Because Ayurveda says there is a Vata Prakriti, Pitta Prakriti, Kapha Prakriti, Vata Pitta Prakriti. So Ayurveda says whenever there is a Pitta, hot, heat and hot, Pitta constitution is naturally prone for the excessive thirst. Polydipsia is very common. Atitrishna, this is a Sanskrit word, very common in the Pitta dominant people. Okay, how much quantity of water and other liquid substances such as the lentil soup, buttermilk, fruit juices, sugarcane juice, lassi, tea, coffee, soft drink is consumed by the person, by the patient throughout the day. You have to check it out. Okay, even after applying moisturizer, cream, cold cream, does the skin feel dry? Even applying the moisturizer, if your skin is dry, that is a problem of Udakvaha Srotas. Udakvaha Srotas. Okay. Due to engagement in the activities, many patients say, "Oh, I am quite busy," and then they neglect thirst sensation. Trishna. Trishna is a vague. There are 13 natural urges that Ayurveda has said, and the natural urges has a Sanskrit word vague. Kshit, trut, like that. Hunger, thirst, these are the natural sensation. But if you are overlooking that, you are neglecting that thirst sensation, that can be the cause for your Udakvaha Srotas Dushti Lakshana. Prashna Pariksha, Prakrit, do you engage waterless fasting? That means Nirjala Upavas in Marathi or other similar practices. Do you do that? Can you tolerate that? Do you consume water 1.5 to 2 liter per day, even though that is important, you are not thirsty? That means you don't feel too water. But some doctors, some health experts, some magazines, they are bombarding. Drink water, drink water, drink water. Ayurveda is not allowing that. Ayurveda is not saying. Ayurveda says, if you have the thirst, then only drink. Because Pitta Prakriti will have more thirst, Kapha Prakriti will have the less thirst. So no compulsion. Because Ayurveda believes, like the food, water should also be digested. Remember these words. Like the food, water should also be digested. Okay. Do you know that you have to ask the patient, excessive consumption of water may lead to the various problems. Like, for example, the person has to go for frequent urination. Then there may be edema problem. There may be sinusitis problem. So, and certain different types of problem. So, ati jalajanya, that means vikar, the word is Ayurveda. Ati jala sevana. Ati jala sevana janya vyadhi. After drinking a lot of water without the expectation from the inner side, inner instinct, if you are drinking the water, that can cause the side effects. So remember, water drinking is also based on your prakriti. Do you experience excessive sweating in the large quantity? And then do you compensate it by drinking water? If not, then Udakvaha Srotas problem. Investigate the possible causes of Udakvaha Srotas Dushti or pathology. You can ask whether you can determine the prakriti of the patient, whether it's a Vata Pradhan, Pitta Pradhan, Kapha Pradhan. Then accordingly, you have to check the Udakvaha Srotas. Do you experience, ask the patient, more trouble during the summer season? Then his Udakvaha Srotas may be a little bit weak. Okay. Whether the patient has any occupation which requires a continuous work in the hot environments. For example, working near the furnaces, working in the glass factories, working in the chemical industry, working in the dyeing factories, all in these areas, lot of heat is generated, and that can damage the Udakvaha Srotas of that particular employee person. Okay, next we will. Is there a diet, your food, your lifestyle, or behavior is like this that can increase the more heat in the body? If more heat in the body, that can damage to the Udakvaha Srotas. For example, staying awake at night regularly, night shift, engaging in continuous physical activity, overexertion, physical exertion, occupations involving constant exposure to the heat, or ill-damaging habits, like for example, always smoking, alcohol, tobacco, that can also increase the heat in the body and damage your Udakvaha Srotas. Even food, consuming too much spicy, too much pungent and hot foods regularly, that can damage Udakvaha Srotas. Eating dishes with a high amount of green chili paste, then garlic chutney made from the crusted garlic cloves, having an excessively hot temperament, your mental is very, very angry, being too ambitious, experiencing too much mental stress, that all are the causes for Udakvaha Srotas Dushti. Consuming excessively dry and rough food, such as the popcorn, chips, crackers, toast, salads all the time. No milk, no ghee, no water. That's bad. Are there any symptoms indicating Udakvaha Sroto Dushti or pathology? For example, the patient, whether he is experiencing excessive thirst, whether the patient is having the dry and rough sensation on the tongue, throat, and the lips, does the palms and sole of the feet become cracked? Is there an excessive dryness of the skin? All you have to ask. Supportive investigations. In cases of diarrhea and vomiting, serum electrolyte balance or serum electrolyte study, what is the sodium, what is the chloride, what is potassium, has to be assessed the severity of dehydration, for the severity of dehydration. In the patients with ascites, abdominal tapping, peritoneal tapping is performed to collect the fluid for the laboratory analysis. In diagnosis of the hypovolemic shock, in cases of dehydration, blood pressure is very, very important. My dear friends, this is all about the Udakvaha Srotas examination, but let me tell you some of the important features mentioned in Charaka Vimansthan, chapter number 5. Okay, Dushti Karana of Udakvaha Srotas. For example, Aushnyat, Amat, Bhayat, Panat, Atishushkanna Sevanat, Ambuvahini Dushyanti. Ambuvahini means Udakvaha Srotas. Dushyanti Trishnayaschya Atipidanat. This is the Sanskrit quote, Charak Vimanstan, chapter number 5. I have the separate PPT on my mobile app program in clinical examination. So you go for that, purchasing the clinical examination mobile app from Ayurveda Academy. Okay. Then Dushti Lakshana, Udakvaha Srotas Dushti Lakshana, Pradushtanam tu khalu idam Vishesha Vidyanam Bhavati. Jivha, Talu, Oshtha, Kantha, Klom, Shosha. Shosha means dryness. Pipasam cha ati pravruddham, excessive thirst. Drishtva Bishak Udakavahanyasya Srotamsi Pradushtani iti vidyat Charak Vimanasthan, chapter number 5. For example, the causes Ati Ushnata, excessive heat, Ama, indigestion, and there is a toxin-like material which is called as Ama, fear, tension, Madhyapan, alcohol, Atishishka, Vidahi, irritant foodstuffs, and Trushna Vega Vidharana. That means neglecting your thirst sensation. These are the important causes of Udakvaha Srotas Dushti. Then problems, the diseases, main diseases with the Udakvaha Srotas pathology. Number 1, Trishna, that is excessive thirst. Number 2, Shotha, that is edema. And number 3, Udara, that is the ascites. My dear friends, this is all for today about Udakvaha Srotas Pariksha. And if anybody have the problem, any health problem, you can WhatsApp on 9226810630. Ayurveda Academy has a fantastic team of doctors with the pediatrician, gynecologist, Ayurvedic, neurologist, everybody is there to help you. Please come to us and discuss your health problem for the paid online consultation. For the disclaimer, कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्य की सलाह लेना जरूरत है. Please like this video, share this video, and don't forget to press the bell button icon and subscribe my channel to see this type of interesting videos by Professor Deshpande. I wish मिलते हैं अगले वीडियो में, तब तक स्वस्थ रहे और खुश रहे. I